Hi, my name is Connor Heinen, and the nursing intervention that I chose for this scenario is therapeutic communication. So, what is therapeutic communication? Therapeutic communication is a face to face process that advances the physical and emotional well being of a patient. It basically is taking the time to hear the patient out, to get a better understanding. And I think this helps and leads to um, creating a great relationship with the patient, which also could help you understand why the patient is so angry. So, what are some effective strategies that are used for therapeutic communication? The first one is providing general leads. This is like throwing a dog a bone. Providing general leads is giving the patient something to work with and asking them a question to keep them busy. For example, a patient complains of pain. Ask them how severe the pain is, followed by another question such as, where is the pain coming from? Providing general leads is always a question followed by another question that encourages initiation and elaboration of a conversation. Another strategy is using silence. A nurse will pause, sit down next to the patient, allowing them to have time to think. This can help the patient become more comfortable with you. Offering self is another strategy. Offering self, the strategy ties into all of these strategies. Offering self shows the patient your concern for the patient and your motivation to help them deal with whatever they're going through. Another strategy is seeking clarification. Um, Seeking clarification, make sure you as a nurse understand what they're trying to say. Ask them a question if you're confused. A lot of times patients get very angry because healthcare staff misunderstand what the patient is trying to say. And um, and that makes the healthcare provider look like they weren't paying attention. So that alone can make a patient angry. Another strategy is giving information. Um, it's always important to give reliable and credible information to a patient. A lot of times patients are scared and there's so many things going on. Most of the time patients just want to answer to something so they can process what they're going through. Another strategy is using reflection. So reflect the same words back to the patient. If the patient says, I'm so scared for the surgery tomorrow, reply back saying, you're scared for the surgery tomorrow? And that shows them your interest in what they're saying and gives them an opportunity to explain why they're scared. The reason they're saying that is they're looking to you for support. So if you say the same thing back to them in the form of a question, it opens them up. It opens it up for them to talk to you about it, and can a lot of times help them cope with their fears. And the last strategy that I have chose is summarizing. So it's important to summarize up the main points that the patient was talking about. So after your conversation, acknowledge that they covered everything and gave good information. So those are the effective strategies that I chose for therapeutic communication. Therapeutic communication is all about getting on the same level as the patient. This can make the patient feel more comfortable and safe. This also can install trust between the nurse and the patient. A patient may be angry, but there is always a reason why. Using therapeutic communication is a great way to get to the bottom of the issue, and you may find that a patient might be yelling at you when you come into a room, but might be smiling and saying thank you when you leave it. So I think therapeutic communication, because its focus is so much on getting to know the patient, hearing them out, having a conversation with them, um, is so important. And that's why I think therapeutic communication is a very effective way to deal with this scenario. Thank you.